I really can't speak for our Part A grantee, but they were on the phone call Friday, and I know that the person, our grantee manager, was extremely frustrated afterwards. For the past 2 months, she's been asking the Bureau for information about the clients potentially being dropped from 400 to 300%. And when I mentioned that again in the phone call, someone said, oh, that's how much Palm Beach County has. Out of the clear blue, someone just threw out a figure for Palm Beach County. Now she would like to know how many clients who have Medicare Part D who might be dropped for those few months. I mean, I could have my ADAP staff manually go over 1,000 charts, but again, that's so ineffective. And if you want to move smartly, again, it's what Joey said, we need to have some access to the data. And I can't speak well enough of Rich Power, I mean, in terms of what he's done with HMS and CareWord, the fact that he can write reports so quickly, get them out in the field, test them, and I just don't understand why we can't have the same access to the ADAP database.
Well, I don't think there's a problem in getting out just sort of aggregate numbers, as long as you're not talking about necessarily client level data, or you're just talking like aggregate numbers as far as Part E.
Well, even locally, I'd like to see us, the ADAP staff, have access to even client level information. There's no reason why that can't be done at the local level.
Well, and you know, there is discussion about, I think the goal overall is to integrate the ADAP system into a larger HMS or some other umbrella system. And that will, if that occurs and when that occurs, it would allow additional resources for programming and report writing. Because right now we've got one programmer who's primarily responsible for any programming needs and reporting.
That would be the ideal solution, to have them integrated.
So that discussion is already underway.
Thanks.
Go ahead. I just wanted to echo, I too, from the area, from the team's perspective, even though we cover 9 and 15, asked for data back in June or July when it first happened, and still have yet to get the data. So I think there is, at the very least, there is an issue, an established issue with getting the aggregate data from the ADAP division.
And it's nothing that your local staff can provide.
No, because otherwise, it's what Mitchell said, it's more like a manual count in order to get that level of data. And with 15, for example, with many of the other areas that cover multiple counties, that is quite a process. And I guess like just to echo what Joey was saying, if your staff is spending time putting it in, then the expectation would be that we could get it out.
Or some report there.
Yes.
So, thank you.
We are way ahead of schedule, so if there's other comments or questions, please feel free. Bobo?
I want Kim's point to be missed. And I mean, I'm thinking back to the back how this is going to affect my Part C. You know, if we're talking about testing folks and not having something to offer, you know, then my numbers in a rural county where no other health care services are available for my Part C, my numbers are going to go down, and then HERS is going to reduce my funding. So we need to really take, like I said, we need to partner with this and get some real information back and forth.
You're also going to lose the trust of your community.
Joey,
I said something, I'm kind of surprised because I didn't get any reaction either from the group or from Joe. But I need to know, are you going to give us data, or are we going blind on this? Because this is a crisis at the local level, because we have finite resources, and in order for us to cover pharmaceutical costs and the manpower to do the PAPs, let me say that one more time, the manpower to do the PAPs, because each client can have anywhere from 4 to 9 applications that you have to do, especially for drugs that are non-HIV drugs. So we're taking case managers and all kinds of other people to start doing things that aren't their job on top of their job. So this is a complete disruption of the service delivery system. Some of you might not know it yet because it hasn't really started to kick in, but we need data. We need to be able to have some discussion about how we're going to move forward so that we don't have anyone other than this initial 350 to 400, but I believe it's way more than that are going to get disenrolled, and how all of this is going to be communicated ongoing from now on. Because I hope someone on the body makes a motion that this group, and maybe a monthly or right now a bi-weekly communique from the ADAP department saying what's going on, because lack of information at the local level is worst case scenario fears in the clinics and with clients and support groups. And What I conveyed to you today was not just Joey's opinion, but I've gotten lots of emails and texts from grantees, from clinics, from clients, from support groups. There's a lack of information out there, and that's what's causing the panic, and that's what the media is feeding on. I've staved off a couple of calls from newspapers and people wanting to stir this up because I want to fix this. I don't want to create hysteria.
Right.
But if we're not going to get data and we're going to be guessing, I'm just going to communicate that to the media because I don't want people to think that we dropped the ball. Because I need data to make decisions, because I sit on a lot of local bodies that we have to deliberate about things. And so we need to know your intentions, because you've heard several people from several different areas say, since June we've been asking for data and we've gotten nothing.
No, I hear you loud and clear, and you certainly have my commitment. I'm going to go make sure I pull your email and look at the data request, and we'll get things underway. I can, only apologize that we have just been, I guess, all sort of overwhelmed by this crisis and the variety of demands, and that doesn't excuse anything, but I just want to share that. It has been by far the most stressful time in my 15 years in the Bureau, and it's like not only do we have a crisis, but it's like we've had multiple it just seems like everything in the last few months has sort of come to roost. So I'm just sharing that to let you know that it's certainly not our intent not to share data, and we will redouble our efforts to do that. But it has been an extremely challenging few months here, as I'm sure it has been with all of you in the field. We've experienced just a number of challenges internally. So I just want to share that, but also share my commitment that we're going to redouble our efforts to meet the data needs for the community, because again, I mean, and that's what I want to hear from y'all. You're giving me a lot of good information and feedback of things that are not working very well. So, I mean, that's why I'm here. So I'm taking note, and we'll go back and follow up to improve things and get this process working more efficiently.